Now, many people are dealing with a painful condition, but they don't feel comfortable talking with their doctor about it.
But they should. I spoke with a doctor that explains why. It is a complex condition where there is no simple test to diagnose it, and not many people actually talk about it. Yet, as many as 13 million adults in the U.S. suffer from it. And we are talking about irritable bowel syndrome, or IBS. April is actually IBS Awareness Month, so Dr. Susan Lucak is joining us to spread the word that sufferers should not suffer in silence. Doctor, thank you so much for joining us this morning.
Thank you very much, Tina, for having me.
Well, let's start with what really is the prevalence of IBS in our society.
Irritable bowel syndrome is the most common gastrointestinal disorder in the United States. People who suffer with this condition experience abdominal pain or discomfort associated with either constipation, which is one of the 3 subtypes, or IBS with diarrhea, or IBS mixed bowel habit pattern, where they alternate between constipation and diarrhea. IBS-C is a common subtype, and as you mentioned, as many as 13 million adults in the United States suffer with IBS-C. So it's a very common condition.
And it may be an uncomfortable subject to talk about, but why is it so important that we're very candid with our physician when we're talking about these symptoms?
In my practice, when I see patients with IBS-C, many of them suffer for years before they come and see me. They suffer in silence, and they really don't need to. If their symptoms of abdominal pain or discomfort and constipation are frequent, if these symptoms keep on coming back, and if they impact on their quality of life, they really need to go and talk to their doctor. It's not just something they ate or just because they are under stress and they think that these are symptoms that are related to that. It's important that they talk to their doctor because they can get help. They don't need to suffer in silence.
Well, I love that we're talking with you today, doctor. So coming from your side of it, what information would be helpful for you to diagnose them correctly? What information are you looking for?
Well, I'm looking for certainly the symptoms of pain, abdominal pain, and constipation, and the chronicity of their symptoms, that these symptoms keep on coming back and then they impact on their quality of life. And that oftentimes the onset of their symptoms is in young age. The group that gets these symptoms are individuals between the ages of 20 to 40. And women are more commonly affected than men. So certainly these are kind of aspects that are important for a doctor to recognize. But the fact that the symptoms are impacting on their quality of life is very important, because that will help us in determining how to treat this condition. Initially, we can start the treatment with a proper diet, supplement with fiber, making sure that patients drink enough fluids and exercise. But if these measures do not sufficiently treat, or if the symptoms persist, then it is important to consider a medication such as Linzess. Linzess is a prescription medication that is approved for treatment of adult men and women with irritable bowel syndrome. And this is a medication that treats the pain, abdominal pain, and constipation. As with all medications, side effects may occur. The most common side effect of Linzess is diarrhea. But when I use this medication, when I use Linzess in my patients with irritable bowel syndrome, their abdominal pain and discomfort improve. And that really is something for patients or for people, for your viewers, to recognize that if they suffer with these symptoms, that there is help, that there is treatment available to them.
Well, I'm so glad that we're having this conversation. Doctor, is there also somewhere where we can go to get some more information?
Yes, for more information and also to hear about patient experiences, visit YouTube and search for About IBS-C and CIC.
Don't go anywhere. The Morning Blend will be right back.